Ulcerative colitis. Decoding UC for NCLEX success. Ulcerative colitis, UC, a type of inflammatory bowel disease, stands as a complex condition with its roots embedded in the intricate workings of the gastrointestinal system. Distinguishing itself from its counterpart, Crohn's disease, UC homes in on specific territories, the colon and rectum, causing inflammation and ulceration in their inner linings. The essence of ulcerative colitis. Ulcerative colitis manifests its characteristics in distinct patterns, illuminating its unique nature. Nature of onset of ulcerative colitis. The onset of UC can be gradual, creeping upon individuals gradually over time, or it can strike suddenly, disrupting the status quo of an individual's health. Site of origin and progression. Typically, UC initiates its assault in the rectum, gradually extending its reach throughout the expanse of the large intestine in a uniform and methodical manner. This stands in stark contrast to the scattered nature of Crohn's disease, which can afflict any part of the gastrointestinal tract and the entire bowel wall. Flare-ups and remission. Patients navigating UC often oscillate between periods of flare-ups and phases of remission, each significantly impacting their quality of life and health management. The anatomy of ulcerative colitis. Delving into the large intestine, the hallmark of UC lies in the profound inflammation it provokes within the large intestine, its extent varying based on the type and severity of the condition. This inflammation catalyzes the demise of the lining cells, fostering the formation of ulcers that bleed and generate pus. Ulcerative colitis affects the large intestine. In this compromised state, the large intestine falters and its normal functioning. Absorption of water becomes a challenge. Ordinarily, as gastrointestinal contents traverse from the small intestine into the large intestine, water absorption occurs, gradually solidifying stool. However, under the duress of UC-induced inflammation, this process is impeded. The result is persistent diarrhea, often tinged with blood and mucus as it traverses the ulcers. Nursing interventions for ulcerative colitis. A compassionate approach. Nurses, as frontline caregivers, play a pivotal role in managing and supporting individuals grappling with UC. Their interventions span a spectrum. Monitoring and assessment UC patients. Vital signs, bowel movements, characteristics and frequency, hydration status, and daily weights constitute the crux of vigilant monitoring. Additionally, a keen focus on gastrointestinal assessments ranging from bowel sounds to tenderness holds significance in early detection and intervention. Vigilance for complications in ulcerative colitis. The watchful eye extends to potential complications such as toxic megacolon and peritonitis, characterized by specific signs and symptoms warranting immediate attention. Ulcerative colitis dietary guidance. Education on dietary modifications forms an integral part of nursing intervention, steering patients away from triggering foods during flare-ups while advocating for low-fiber, high-protein options to ease gut distress. Medications and surgical pathways for ulcerative colitis. The pharmacological landscape in managing UC traverses a diverse terrain. Medications. Tailored prescriptions ranging from anti-inflammatory agents like 5-aminosalicylates to immunosuppressors and immunomodulators address the spectrum of UC severity. Each class of medication targets different facets of the disease, offering a personalized approach to treatment. Medications and surgical pathways for ulcerative colitis. The pharmacological landscape in managing UC traverses a diverse terrain. Medications. Tailored prescriptions ranging from anti-inflammatory agents like 5-aminosalicylates to immunosuppressors and immunomodulators address the spectrum of UC severity. Each class of medication targets different facets of the disease, offering a personalized approach to treatment. Surgical options. For cases where medication falls short, surgery emerges as a viable route. Procedures such as proctocolectomy or ileoanastomosis pave the way for alleviating symptoms and improving quality of life, albeit with distinct implications for postoperative care and lifestyle adjustments. Holistic care and education for ulcerative colitis. Central to nursing care is the dissemination of holistic education, encompassing the significance of regular colon cancer screenings, ostomy care for post-surgery patients, and the nuanced understanding of administering medications, each tailored to individual needs and responses. The complexities of ulcerative colitis. In unraveling the complexities of ulcerative colitis, nursing care assumes a multidimensional role, intertwining medical expertise with compassionate support. As advancements continue to evolve in the realm of UC management, the pivotal role of nursing care remains unwavering in enhancing the lives of those navigating this intricate disease landscape. The ongoing quest for UC comprehensive care. Patient education. The pillar of empowerment. Empowering patients with a comprehensive understanding of UC stands as a cornerstone in their journey toward managing the condition. Dietary guidance reimagined. A personalized approach to dietary recommendations involves not only identifying trigger foods during flare-ups, but also fostering a deeper understanding of the nutritional choices that can mitigate symptoms and promote gastrointestinal comfort. Engaging patients in crafting tailored meal plans elevates their sense of agency in managing UC. Medication literacy. Navigating the diverse landscape of prescribed medications demands a holistic understanding, unveiling the mechanisms of action, potential side effects, and adherence strategies. Empathy-driven education aids patients in making informed decisions about their treatment journey. Redefining support systems for ulcerative colitis. Beyond the realms of medical interventions, support networks play an indispensable role in the holistic care paradigm for individuals battling UC. Psychological support. The emotional toll of managing a chronic condition like UC necessitates avenues for psychological support. Providing access to counseling, support groups, and mental health resources fosters resilience and aids in navigating the emotional challenges inherent in the UC journey. Family and community involvement. Involving family members and fostering community engagement amplifies the support system, creating an ecosystem where patients feel embraced and understood. Awareness campaigns and community-driven initiatives contribute to a more informed and empathetic societal outlook toward UC. The evolving landscape, research and innovations. The landscape of UC management is perpetually evolving, driven by ongoing research endeavors and innovative approaches to treatment and care. Cutting-edge research, continued exploration into the etiology of UC holds the promise of unveiling underlying triggers and potential breakthroughs in targeted therapies. Advancements in genetic studies, microbiome research, and immunological investigations pave the way for novel insights into disease mechanisms and personalized treatments. Technological advancements. Technological innovations, ranging from telemedicine applications to wearable devices tracking physiological parameters, revolutionize the delivery of care for individuals with UC. Telehealth platforms offer increased accessibility to healthcare providers, facilitating timely interventions and continuous monitoring. Signs and symptoms of an ulcerative colitis flare-up. Understanding the telltale signs. Identifying the signs heralding an impending UC flare-up is pivotal in proactive management and timely intervention. Gastrointestinal distress in ulcerative colitis. Increased bowel movements. A surge in the frequency of bowel movements, often accompanied by urgency and an inability to control bowel movements, characterizes the onset of a flare-up. Bloody diarrhea. The hallmark of UC exacerbation is the presence of bloody stools, indicative of the inflammation-induced ulceration in the colon and rectum. Abdominal pain and cramping. Intensified abdominal discomfort, ranging from mild cramps to severe pain, accompanies the inflammatory surge within the gastrointestinal tract. Systemic symptoms, fatigue and weakness. Debilitating fatigue, beyond the ordinary, often accompanies flare-ups, impacting daily activities and overall energy levels. Fever. An elevated body temperature might signify an inflammatory response, signaling an exacerbation of UC. Variability in symptoms. The spectrum and intensity of symptoms during a flare-up can vary significantly among individuals. Factors such as the extent of inflammation, the severity of the disease, and an individual's response to medications contribute to this variability. Importance of prompt recognition. Early recognition of flare-up symptoms empowers patients to promptly seek medical attention, facilitating interventions aimed at curbing the exacerbation and preventing complications. Monitoring these signs becomes crucial for both patients and healthcare providers in devising an effective management plan tailored to individual needs. Medications for managing ulcerative colitis flare-ups. A multifaceted approach. The arsenal of medications designed to combat ulcerative colitis flare-ups encompasses various classes, each tailored to address specific aspects of the inflammatory response and symptom management. Anti-inflammatory agents. 5-aminosalicylates, 5-ASA, sulfasalazine, often the first-line medication for mild to moderate cases. 5-ASA aids in maintaining remission and preventing flare-ups. In cases where sulfasalazine is ineffective or contraindicated due to sulfa allergy, alternative 5-ASA formulations might be prescribed. Steroids, corticosteroids, prednisone. When 5-ASA fails to deliver the desired outcomes, corticosteroids come into play. These potent anti-inflammatory agents are employed to quell severe inflammation during flare-ups. However, due to their significant side effects, including glucose elevation, skin thinning, and bone density reduction, they are not intended for prolonged usage and are typically tapered off gradually. Immunosuppressors and immunomodulators. Azathioprine/imurin. Immunosuppressors. Used in cases where other medications prove ineffective. These drugs modulate the immune response, reducing inflammation. However, they carry risks of increased susceptibility to infections and certain cancers. Adalimumab/Humira. Immunomodulators and TNF blockers. Tumor necrosis factor, TNF. Blockers like adalimumab target a protein integral to the inflammatory process. Administered subcutaneously, these medications require cautious monitoring for potential risks, including reactivating latent infections like tuberculosis and elevating the risk of certain cancers. Targeted symptom management. Beyond addressing inflammation, medications also target symptom relief and complications associated with UC flare-ups. Antidiarrheal medications. Imodium, loperamide. Employed sparingly, these medications aid in controlling diarrhea. However, their usage requires careful monitoring due to the risk of exacerbating toxic megacolon, a severe complication of UC. Pain management. Non-steroidal anti-inflammatory drugs, NSAIDs. Avoidance. NSAIDs are strictly contraindicated in UC management as they can provoke flare-ups. Pain relief, when necessary, is typically managed with acetaminophen, Tylenol, or other non-NSAID options. Individualized treatment strategies. The selection of medications hinges on the severity, extent, and individual response to treatment. Combining medications might be necessary for moderate to severe cases to achieve optimal control over flare-ups and maintain remission. Surgical considerations. For a subset of individuals with UC, medications might not provide adequate relief, leading to consideration for surgical intervention. Procedures like proctocolectomy or ileoanastomosis might be suggested to alleviate symptoms and improve quality of life, albeit with significant implications for postoperative care and lifestyle adjustments. Chronic ulcerative colitis. Sustaining management through medications. Long-term management strategies. The chronic nature of ulcerative colitis demands sustained and tailored treatment strategies aimed at achieving remission and preventing flare-ups. Medications play a pivotal role in this long-term management, targeting inflammation, symptom control, and disease progression. Maintenance medications. 5-aminosalicylates, 5-ASA, for UC. Continuation of 5-ASA medications post-flare-up aids in maintaining remission. These drugs serve as a fundamental component of long-term management for their ability to mitigate inflammation and prevent recurrence. Immunosuppressors and immunomodulators for UC. Beyond their role in managing acute flare-ups, drugs like azathioprine or anti-TNF blockers might be prescribed for their immunomodulatory effects to sustain remission and reduce the frequency of relapses. Regular monitoring for side effects and efficacy is paramount in their long-term usage. Biologics. Biological therapies, e.g., vedolizumab and infliximab, for UC. In cases refractory to conventional treatments. Biologics offer a targeted approach to modulating the immune response, administered via infusion or injection. These medications aim to curb inflammation by targeting specific proteins or cells involved in the disease process. Importance of adherence and monitoring. Sustaining the efficacy of chronic UC management heavily relies on patient adherence to prescribed medications and close monitoring by healthcare providers. Adherence. Medication compliance. Consistent adherence to prescribed medications is paramount in preventing relapses and sustaining remission. Education and ongoing support foster patient understanding and commitment to long-term treatment. Monitoring. Regular follow-ups and assessments. Periodic consultations and assessments allow healthcare providers to gauge treatment efficacy, monitor for potential side effects, and adjust medication regimens as needed to optimize disease control. Surgical considerations in chronic cases. For some individuals with chronic and refractory UC, surgical intervention might emerge as a consideration, especially in cases where medications fail to provide adequate relief or to mitigate complications such as toxic megacolon. Surgical options, ranging from partial colectomy to total proctocolectomy, offer definitive solutions with implications for postoperative care and lifestyle adjustments. The dynamic landscape of treatment advancements for ulcerative colitis. Research and clinical trials continue to unveil novel treatment avenues and refinements in existing medications, fostering optimism in the management of chronic ulcerative colitis. Emerging therapies for ulcerative colitis. JAK inhibitors for UC. Janus kinase, JAK, inhibitors represent a burgeoning class of medications showing promise in modulating the immune response and managing chronic inflammatory conditions like UC. Ongoing research explores their efficacy and safety profile in the context of UC treatment. Fecal microbiota transplantation, FMT, for UC. Experimental approaches like FMT, involving the transfer of healthy gut bacteria from a donor to the patient, aim to restore the disrupted microbiome in UC. While still in investigational stages, FMT holds potential as a future therapeutic avenue. Navigating the chronic terrain of ulcerative colitis. In conclusion, traversing the chronic landscape of ulcerative colitis, a multifaceted approach to medication utilization tailored, sustained, and periodically adjusted is imperative. By embracing evolving treatment modalities, healthcare providers endeavor not only to manage symptoms but also to foster sustained remission, improve quality of life, and explore new frontiers in the pursuit of long-term disease control.